9:30 and Saturday 12:12, and we are going to start a free live Soothe Your Back Pain classes. These classes have been designed by me um, initially from my own needs with back pain. I have suffered with back pain pretty much since adolescence. I'm a physiotherapist now, and started always had the back pain. It progressed through my career, beginning of my career in physiotherapy, and I got to a point where I realised I couldn't practice anymore. I was struggling to treat patients because of the positions that I had to get myself into, and it was a big wake-up call for me to look after myself. So it's something that I wasn't doing. I was preaching all, the advice and the exercises and passing on to patients, seeing patients improving, learning new skills, improving my skills, but I was not looking after myself. When I saw myself in um, you know, in a situation where my career could be on the line, yeah, I made the change and I committed to it. So I developed this class every day until my pain went. And every day I was understanding about the movement, understanding about my pain, how it reacted to movement, how it reacted to progression of movement. And so I bring here for you, unfortunately, I cannot bring the whole progressed class. I need to get people involved and learning the movement, learning the concepts so that we can progress gently and safely. But I can definitely give you an hour sample, which would be the hour class, but what we call the level one class. So there's 6 levels, and this is a level one. So the level one is about learning the movement, how to produce the movement to be safe, most of all, understand who should be doing and not doing this class, and also I'll be guiding you. I'll be guiding you in different ways of doing the same movement, because not everybody have the same range of movement. Not everybody has the same ability. So I'll be able to change slightly the movements and show you the different ways you can do. You can keep this recording for as long as you want, repeat as many times as you want. If you want to do it once a day, twice a day, 3 times a day, it's absolutely safe. But we'll give you some guidelines before you start doing this video today with me. So it's very important to understand the concept of the class, because there's a lot of information that I pass on, information about the body, how the body works, and all in simple terms, everything that it makes it easy for anyone to understand. I'm not going to speak scientific words. I don't like them. So I'll be talking frankly, as I talk to my patients in my sessions, and I find it helpful because I can expect them to understand physio terminology. So, I speak as I would like to a doctor actually to speak to me, because I don't understand certain medical terminology. So it's just making it viable and making it, touch people's hearts so that they can make the change. Okay, and I think that's the first step to self-healing, is when it touches your heart. When the first is the realization really that you need help, and then when you get and find the help and you find that person that can help you, it's committing to it. Yeah, it touches your heart and you commit to it, and that's the most important step. Everything else that comes after, just follow a path, follow a timeline, and eventually you get there to the healing of yourself. Yeah, so today you're here with pain, discomfort, mobility issues, and you make that realization, you make that self-awareness. And through the classes, I'll be bringing self-awareness of your own body, how to heal, tools of healing, how to progress, and then you get there. Okay. Of course, the other classes are paid classes, but I think even if you just have the free class, because I'm not selling it, yeah, I'm not selling it. Even if you just have the free class will be absolutely, absolutely amazing for you. I do pretty much the level one on myself every day. And the reason I progress the class is because um, people have different ways of managing their own body, managing their own time, managing their own ways of treating themselves. Some people are more proactive, or I wouldn't say proactive, but some people are more independent when it comes to um, keeping up with certain routines, and other people sometimes need a little bit of more support. And I'm a kind of person that needed a lot of support, and then eventually I had to learn how to be a bit more independent. But I'm here because I would like to be that support for those people that still need the support, and so that you can sign up every Saturday, and then you have access to the Zoom link where it's free and you can share with other friends. And they can be on the screen with you, and we can share, we can talk. I can see each one movement as well. If I stop for a bit, I can check everyone, will give you advice on how to do slightly different. So it's a very interactive class. And then at the end, I can do a little bit of a Q&A where I'll be answering your questions. Just be aware that you are on live, and I'm happy to answer any questions. But if there's anything very personal, you can write me a message. I can answer that if you want me to, or I can answer privately with you after the Q&A. But I'll be absolutely happy to answer any questions, okay, about your physical symptoms, your physical sensations, your pain, your troubles, and give you the advice that you need. Okay, so um, step number one for the class, I need to explain what conditions or what symptoms, if you have, I would ask you not to do the class. And the reason is because as a physio, I know we have to assess people. Okay. Yes, of course, there's lots of yoga classes out there, and Pilates classes online that people can, fitness class. But it's my responsibility to let you understand where is that fine line. Okay, so you're safe and you don't hurt yourself. Um, and if, of course, you're assessed by a physio or any other physio, and maybe you can explain to them what the movements are, or show the video, and they say, yeah, that's all right, you can do it. Or if you've been given physio exercises and they are very similar to the ones I'm doing, you can do it. But if you've not had any physio session, not seen any physio, not been assessed, and you have these specific symptoms I'm going to mention now, please do not participate on the class. You can get in touch with me and we can have a little assessment. We'll have a chat. And then if you feel that if you both, after the assessment, understands that it's safe for you to do it, then you can continue to use the free live virtual classes. So if you're experiencing, this is very, very, very important. If you're experiencing pins and needles down your legs, down your arms, okay, any facial numbness, I want you to abstain from doing the video. You can contact any practitioner, including myself, and we can have an assessment and understand why you're having those symptoms. Because I don't want any of the movements to give you any more compression or worsening of these symptoms, and it won't be safe. Okay, so I'm being very clear. Make sure that you don't do the exercise. And other symptoms also, if you're having difficulty swallowing, difficulty speaking, blurred visions, dizziness, blackout visions, if things like when you're getting up from a chair or lying down and your head spins, you have a bit of a vertigo, I also would like you kindly not to do this class for your own safety, okay, unless you are assessed thoroughly. If you're experiencing any sharp pains, really sharp pains that takes you off your feet, and you are left with throbbing pain throughout the whole day, the whole night, intense pain, I'm talking about intense pain, do not do this class, okay? There could be something else wrong going on, and any movement, and I'm just talking not the class movement, or simple going into the cupboard to reach something might be just enough to settle, exacerbate something. So please go to a physio and get assessed. Find out why you're having these pains. Don't wait too long. The longer you wait, the more troubles, more things you have to solve. If you find that you have weakness on your foot and they feel like they're flopping on the floor when you're walking one foot more than another, also I would like you to get assessed. If you find that you are getting numbness on your genital areas, front and back, this is a very important symptom for you to be aware of if you have back pain and numbness on your genital area. Do not do the class. If you have one of any of the other symptoms I've mentioned, I would like you to call NHS 111 and discuss your symptoms to the NHS. Get checked in at the A&E. If it's a weekday, you can also call your GP, but they will eventually say, please call NHS 111. These are signs of spinal cord compression, either at the neck or at the lower back. If you have symptoms from head, face, down to fingers, is something related to the nerve compression at the neck. If you have symptoms below the waist, like these symptoms I've mentioned, it's probably nerve compression of the lower back. And those symptoms will accompany a lot of pain. Some people have had disc problems in case of disc compressing on the nerve with very little back pain, very little neck pain. So that's why I'm talking about the symptoms. It doesn't have to necessarily accompany the pain, but it can be very painful for some people. So make sure that you do not do this class today or anytime until you get assessed. Feel free to contact me via my website, virtual-physio.co.uk, and speak to me, Roberta, and we'll have a chat, we'll find out more. But until then, just hold the video. You can watch, but hold the video. At least you watch if you understand that how gentle. This is a very, very gentle class. It's made for those that are suffering with joint pain, back pain, neck pain, shoulder pain. So what my idea is to introduce you to movement gently and gradually, and not to stretch you to the limits, because you're not there yet. Yeah, if you're in pain, your body's telling you something's not right. The pain is trying to stop your body from doing things to hurt you even further. So there's no reason for these movement classes to be extreme ranges where you're trying to reach as far as you can. So we're not dealing with that. That's the first concept of this class. Okay. The second concept is understanding how to allow a muscle to release, how to allow a muscle to relax. We don't want to do massive releases on the muscle because it interferes with other muscles, because they all are in relationship with each other. But there is a way of relaxing the muscles slightly, and that relaxation still have an interference with the other relationship of the other muscles, but it will be very gentle, very gradual, very mild, and in that way the other muscles can understand what's going on rather than being shocked with a massive release, and then it doesn't know what to do and it tightens up all over again after the class. So we need to make sure that things are gradual. When you have an injury, things are sudden, but sometimes people can have a gradual dysfunction of posture. Your posture can be here today, but in about 5-10 years can be here. And that gradual progress of that posture from here to here, it's almost like hair growth time frame, isn't it? It's very slow, very gradual. So the body has times to adapt from here, adapt until you get here. So there's not a lot of pain until it reaches a threshold. When it does reach that threshold, that's when your body gets an ache or a flare up, or a problem here, a problem there. But in the end of the day, it's all about being gentle with your body. Yeah, you've been through a lot. We have been through a lot of pain, a lot of stress. Pain can drain you. So be gentle. Be gentle with yourself. Respect your body. Listen to your body. I will teach lots of body awareness through this course. So it'll be very interesting for you to understand a little bit more about your body, what it feels like to be in your body, but in your body without the pain. And that's what I would like to teach. Okay. Another quick reminder, a quick advice here. When we're doing the exercises, we are going to need a yoga belt. You can also use a dressing gown belt, so something that is taut, not stretchy, for us to do a few of the stretches. Okay. And if you have a foam roller or a half moon foam roller, that's fine. If you don't have any of those, you can use a cushion, or you can use a rolled up towel, really thick, roll it, make into a nice cylindrical shape, and we can use that as these. Okay. I might not use all the equipment today, but every Saturday I'll be introducing, because I want to make sure that things are gradual. Okay. So we're going to start on the chair. Actually, you need a chair. If you have a carpet, it's fine. If you don't, a hard floor, you need a mat and a cushion for your head to support your head. Okay. So just a quick thing. So I had quite a few disc bulges in my back. I never had surgery, thank God for that. Yes, surgery, it can be very helpful for urgent cases. I'm not undermining surgery, but I wouldn't want to go through surgery or the whole aspect of general anesthetics and all that kind of stuff. No, I prefer not to. So yes, unfortunately, I've had, or fortunately, because we learn so much from these experiences. I've had disc bulges, and when you have one disc bulge, the tendency is that you can have either the one above or the one below in a few years' time after the first one. And that's what kind of happened to me. I never looked out for myself. I did a lot of sports, impact. I carried a lot of heavy bags on my back while cycling, running, hiking, and I just, probably chronically dehydrated. My discs were reduced and they were very dry. I was diagnosed with chronic dehydrated disc at the age of 24. So yeah, a few years ago, and yeah, very young for someone. Your discs should be soft at that age, very mobile, very flexible, adaptable, and I was already very stiff. So from then on, I started getting all these disc bulges. Today, I have no pain. I can get out from the chair without stiffness. And to be honest, the stiffness was the last thing to kind of go away, even though it was getting less and less and less and less. But there's also the what I've noticed. It's only been a few months since the stiffness kind of really went. The pain was gone a long time ago, but the stiffness still a little bit there, but not bothering me that much. But what I notice is that I still can, if I get up from the floor now, my brain will say, oh, it's going to hurt. And then I get up and I think, oh, it didn't hurt. So we do have still these expectations of pain, and we still have these behaviors of maybe still using the same. I used to get up a bit slow because you're expecting pain. But then when you get up and you think, oh, no pain. So be aware when those things are happening that the pain is not there, and how your body's moving through that getting up, sit to stand, because it will help you shift that behavior, shift that thought process. And this is the stage I'm on right now, where I'm getting off from the floor and I'm thinking, I know I don't have pain now, and I can just get off the floor. I'm not going to be expecting the pain. I'm not going to be trying to pretend the pain is not there, or ignore the pain, or take the pain. So this is the whole new level of healing. and you are going to get there. Okay, but be aware of your body, understand the pain, feel the pain, but also feel the body healing through the movements, through the exercises. There's a lot that go on. So I'm just going to talk about pain scoring. In physiotherapy, we use a scale from 1 to 10, and 10 being the worst pain, 0 being no pain. So through the class, I don't want to work with pain. So we are going to work 0 pain. But I'm going to give you another scale, which will adapt it slightly. I'm going to use a scale 0 to 5, 5 being a very intense stretch, tension on the muscle, not pain. If you go 6, you might get the pain. But if you go stay on 5, you get the most intense stretch that you can have. But we're going to work between 0 and 3. That's how light the stretch should be. That's how easy it should be. And trust me, it makes a massive difference. Okay? So we're going to work with tension on the muscle 3. We're not going to work with any further tension. And if you move slowly, 1, 2, 3, you'll be able to feel the stages of each tension. If you move too fast, you miss that all. By the time you stop on the ouch. You're going to end up, so everybody that goes to a stretch too fast will end up stop on the ouch point where the pain hits, because you missed to be aware of all these stages. So be very kind to yourself. We are going to move slow into the stretch, hold the stretch for however long I advise, and then we're going to move back out of the stretch. When we move back out of the stretch, using all the parts of the body, and I will guide you on this. And the reason I'm doing this, because the muscle that's being lengthened is gently stretched. I don't want that muscle straining to then go back into a normal state. I want all the parts of the body supporting that. So I will be guiding you on this. Okay. And if you take your dressing gown, belt, yoga belt, or rope, anything that's nice and taut that doesn't give away. If you don't have that, you can use an elastic band, and it can still work. That's absolutely fine. But just don't resist the elastic, okay? So we're going to start with the hamstrings, the calf and hamstring. So I want you to put the rope on the ball of your feet, not below, not on the arch. Rest that leg down on the floor, nice and gentle there. Okay, and you're going to pull your toes. Can you see that? With the rope, pull your toes towards you very gently. Again, you're not even stretching yet, just pull. So whatever distance that you manage to pull without any stretching, that's where you stay. Do not copy my range, you do your own range, okay? And very tall spine, you're going to lean forward like a nice plinth. And you can see I've only moved 2 inches with my body. And I'm already feeling the tension. That's all you need. Just tension, no pain, no straining, okay? And that's what we're going to start with. Especially if you're in pain, this is what we're going to start with. And come back away. And relax, okay? I'm going to do the other leg. We're going to do more stretching. So with the same muscles in different positions. So we're going to repeat the stretches in different positions, which is good. Different angles of the muscle. The progressed levels work a bit deeper into the stretches, but your body needs to be ready for it. It needs to be accepting stretching. Okay. So bring your toes towards you. Your heel is rested on the floor, nice and relaxed knee. You're not tensing anything. And then nice and tall through your spine. Lean forward. And again, I only moved about that far. And I can feel the tension at the back of the leg all the way down. All the tension is just holding the rope with your hand, nothing more. Okay, a good time to hold the stretch between 20 to 40 seconds. So a 30-second rule works really well. And then back. If you're feeling a little bit of strain on your lower back, Again, just move a little bit back out into the movement to make sure that you're not straining any other part of your body. You're going to bring your leg up here. If you struggle to bring your ankle all the way up, you struggle to keep your ankle up here, you can bring your ankle down here. That's absolutely fine, as long as that knee's dropped down, okay? Or if you want to do both at the same time, a bit more gently, you can do in that position and then lean forward. When you lean forward, you're going to feel the stretch here in the corner of that. Nice and tall through your spine and lean forward. When you lean forward, you should feel the stretch in the corner of your bottom there. Okay. Some people might feel tension on the inside of the leg. That's okay. It tells me that your hip is really tight. However, you don't want to feel the pain. You just want to go as forward as you can feel just the tension. So now we're holding the stretch. And then to come away, you can push your leg so your body goes back and you're helping your body go back. So you're not using your back muscles. You're actually using your tummy muscles, okay? So I'm teaching you here how to activate all the parts of your body to support this type of movement, because a lot of the times we end up using just the back muscles and not the core, not the tummy. So by teaching you how to make that switch, when you need to get up from the floor or get something from the dryer and you're lifting up, you'll be learning eventually to use your core. So that's why I ask you to push away, and then you activate all the parts of your body. Okay, I'm going to go the other leg. So again, if you struggle, you can do this way. You can do that way. So you can use the rope and hold there. Yeah, an extension of your arm, and then lean forward. Or you can put it all the way to the top and lean forward. If you struggle, I'm going to do the adaptive ones just for demonstration. Nice and tall and lean forward. You might find that you need to lean forward a bit more, but this way you stretch both glutes, the bottom muscle. And hold. Okay. If you feel a lot of strain in your back, please always return back to the initial position, even before I finish. That's absolutely fine. And the reason being is because people are in different tensions. People are experiencing different tensions in their muscles. So you need to respect that. So when I say respect your body, it means listen to those tension points. Listen to those. Don't allow them to build up. Don't allow them to increase in intensity. We've got to work with very low intensities, very gentle. Okay, so that's good. So now we're going to stretch the outside of your lower leg here all the way to your toes. Okay, so you're going to bring a foot underneath, point your toes back, and push. You're going to push your legs into the floor a little bit. So there is activation here, but you are stretching that line of your foot there. On the other leg, I'm going to show a variation of that stretch, but this is an easy way, especially for those with hip tightness. Okay, so you still get a nice stretch. So I'm just pushing my foot down and kind of forcing a little bit to get the foot to curl a little bit more with the floor, and then you get the stretch on the outside. Okay, so relax the tension and then glide back up. For those that have good hip mobility, you can do this stretch like this. So you're going to grab the front of your foot, point it like a ballerina, and now imagine the sole of your foot pointing towards your face. And that's all. And you should get this line of tension all the way to your toes, and you can curl your toes as well. It's a nice thing to stretch that. Not a lot of people realize how tight that muscle is, but this muscle gives a lot of information to your hips, because that's what helps with your balance side to side. So your hips are the one that are going to counterbalance with these informations that these muscles are giving you, because it comes from the foot, and your foot gives you all the information about your balance, how you step on the floor, what the floor is. Is it stone? Is it uneven? Is it flat? Yeah, and relax. So always bring the movement back, help the movement back, and then come down. Now we're going to do a stretch here on the inside of the legs. You can come to the edge of the chair, and this stretch here, I want you to go nice and tall. If you are slumped and that's comfortable, it's fine. It's absolutely fine. But if you can roll your pelvis to go tall, that's fine as well. Okay, so I'm going to show the tall version. I want you to put your hands on the inside of your knees, shoulders back, squeeze your shoulder blades at the back, squeeze nice and tight. And you're going to push your knees out just as far as you can feel the tension inside of your legs. Hold, push out and hold. So you're pushing your knees out with the tension of your shoulder blades. You're not pushing the knees out with the front of your shoulder. You're pushing the knees out with the tension of your shoulder blades. And relax, let go of the leg a little bit. Good. We're going to do one more, and I'm going to show you a little progression on this one. If you feel that there was too much stretch, please bring your legs in a little bit and try that way, okay? You will still get benefit. So you're going to squeeze your shoulder blades nice and tall through your spine. Squeeze your shoulder blades behind you. Push out your knees. Squeeze your bottom now. Squeeze your bottom. Squeeze your bottom. And imagine a pebble lifting up into your belly button, and hold that pebble up into your belly button and squeeze your bottom at the same time. Three things happening. Pushing the knees out, squeezing your bottom, and the pebble traveling upwards into your belly button. And you're going to release everything nice and slowly in stages, nice and slowly and controlled, and relax. So you can see this wasn't just a stretch. We had core activation, glutes, bottom activation, and the relaxation of your back, because when all those things come on, your back can then say, oh, and let go and relax a little bit. Okay, so that's what I mean by progressing an exercise. It's this minute addition to the exercise that makes such a big difference, and that's what the level 2, 3, and 4, and 5, and 6 will bring to you. Okay, and bring your legs in again. I'm not just, closing my legs, I'm going very, very gentle. So if you have a chair that has space for you to sit sideways, I want you to hold the chair. Make sure you're always safe. You can rest your arm on the top of the chair. The outside leg, so this bottom is not sitting on the chair, okay? Your chair might be taller than mine, and your outside knee might not be touching the floor. That's absolutely fine. That's even better. So what you can do, you're going to walk your toes on the floor and push that knee back. Can you see a line going from the hip backwards on my leg? But at the same time, I'm not leaning forward, because that makes a straight line. There's no stretching. Yeah. So you have to stay sitting on that, my left bottom, my case. I'm sitting on my left bottom. I'm tall on my left bottom. And then I'm just pushing my right leg back. And I'm holding onto the chair. I want to be comfortable and just hold the stretch. Okay. When you come back, you can help. So drop your foot. You can help. Or you can just, if you have not too much tension, you can do it by yourself. And we're going to do the other side. So we're sitting on my right bottom now, left bottom down. Might be able to see a bit better. Okay, and I'm tall and upright. There's a straight line, shoulder, pelvis, knee. I'm going to hold on, sitting on my right bottom, and I'm going to walk my leg back. And now it's brilliant. Good one. So the hip flexors is what we just stretched. The hip flexors help you do knee up. So pretty much walking stairs, and it's a long muscle. It attaches from your spine across and to the front of your hips. So this muscle can stretch all the way back so to get a nice lengthening. But again, you shouldn't be stretching too tense, use too much tension. It should be very gradual and gentle, and you shouldn't be stretching all the time. Of course, it's important that we can assess and see whether that muscle is stretching. But what we just done, it's a very gentle approach, so it's okay to just basically testing your lengthening of that muscle. Okay, we're going to do the same movement again. I'm going to add a different movement, which will stretch these side muscles. That helps you side bend. So they kind of work together. Sideways again. Knee down. So you can bring your leg back a bit. It doesn't have to be as far as last time. And what you're going to do, imagine a line in the pelvis and a line at the ribs. And you're going to grow this line by side bending. You can use your arm. If you have a shoulder pain or ache, you can do without the shoulder, the arm going up. And you can lean towards the chair. Make sure you hold onto the chair with the other hand, and you just hold that stretch. Support yourself nicely on the chair. And push the chair away. Push the chair away, so you're helping with the push rather than coming back with these muscles. And we're going to do the other side. Bring your knee down. Lean on the chair with your arm. Knee back a little bit. Lean towards the chair. Again, you go only as far as you can feel a little bit of tension in this corner. You might even feel it here. So you have to work with the tension that you feel the most and stop before the tension goes too much. Okay. Hold the stretch. And you're going to push the chair with the hand that's resting on the chair. Push the chair away from you to help you come back. And then you're not using these muscles. Very, very good. Okay. I'm going to get the rope again. I'm going to show you stretching standing. Okay. So this stretch is to stretch the front of your legs. Okay. A lot of people struggle to do this stretch, so I'm going to show you an adaptation. You can put your rope on the ankle. And this is an extension of your arm. And you're going to pull the rope to get your heel to your bottom. Okay? If you have to stop here, it's fine. You stop at your own tension. So when you pull, go slow. Remember, we need to feel each phase of the tension rather than going straight and going out because you're going too fast, too far. So go slow. Make sure the knees are parallel. You're not forward like that. Yeah, your body straight line, and you pull your heel to your bottom only as far as you're comfortable, and you hold. You're going to hold that stretch, and you should feel the line of stretch going down to your knee. If you get knee pain, drop the heel and work with that. Every time you do this stretch video, you're going to find that you can stretch a bit further, so don't try to do it all at once. Okay, and we're going to do the other side. I'm going to use my own hand because then I can demonstrate differently. So hold your heel, heel to bum, knees parallel. Can you see how you cannot see my other knee? Because they're parallel, and that's important. Nice and tall. If you find yourself being pushed forward, that's a sign that you have a lot of tightness there. So it's okay if you still pushed a bit forward, but as long as that starts to improve as you do the video more often, that's brilliant. You have to find your starting point. Okay, when I was in my starting point, I was like this. So it takes a bit of time, but that's the best way to change your posture long term. I think quick changes, promises are a bit unrealistic. The body doesn't like quick changes. Like gradual changes, so they can communicate with all the muscles around the body. Another activity where I like to do in standing, okay? This activity is very nice for you to do anywhere. If you're working in the office, sitting for a long time, if you're in a queue waiting for a while, you can do part of this activity, not all of it, but you can do part of this activity, and I'll show you in a minute. But this is a way of you understanding where your posture is, but also reactivating your whole body. No one will see you doing this. No one will know what you're doing. Yeah. But it can activate your whole body and gives you a whole new beginning again. So when you're doing your office space and you find yourself curving, curving, and curving and curving, you think, oh, I'm all the way down here. How can I come back and sit a bit taller for not a few minutes? Yeah. And that's what the body does. It takes it's endurance. You have to teach the endurance to hold the posture to your body little and often. Okay. So I'm going to show you. I'm going to show you forward, and then I'll show you sideways because I want to see what make help you understand what I mean by traveling. So your body is in your normal posture at the moment. You're going to imagine there's a tea towel under your feet, and you want to spread that tea towel apart from with your feet, but you're not moving your legs out like that. You're keeping it still. Ground it to the floor, nice and grounded. And you spread your feet apart. As soon as you do that, can you see that little movement on my legs? That's all you need. Everything activates here. Glutes, quads, calves, everything. Then I want you to tuck your belly button in slightly, chest out slightly, shoulders back slightly, and your head back into your spine. You can do relax like this, or you can open your palms and hold that whole tension through your body. Hold. Imagine you're still spreading that tea towel. You haven't stopped it. You still need that tension through your legs. And then when you let go nice and gentle, and and your body relax, your chest relax, your shoulders relax, your neck relax, your legs relax, everything relax. Yeah. So you're coming down to your tired posture, let's say. But when you're here, you're activating all the muscles through your whole body, fingers out, really nice and tensed, and it activates everything. So let me show you sideways. Let's say you come off the office chair, been sitting there for a couple of hours, you need a good stretch, and you get up and you're like this. We all do this, yeah? So you go into your posture awareness activity, spread the tea towel, activate your legs, tuck your belly button in, chest down, shoulders back, head back, palms out, and you hold that tension through your body. Hold that tension through your body. When you release that tension and you relax, your body travels. Can you see? So every time your body travels, it travels to the old posture. However, this old posture will be less compressed than a minute ago when you just done this. And if you do this little enough through the day, you're going to travel less and less and less and less. And you're going to be able to retain this more. Okay? So it's a good training for your body and your mind to help retain a good posture for longer periods of time. Very simple concept, but it needs to be repeated. Okay? The body likes repetition. Right, so I'm going to move the chair away. We're going to go to the floor. And you're going to need your dressing gown belt, your rolled up towel or foam roller, and your neck pillow. Okay, so nice and comfortable. Make sure your head is supported. I don't want anyone hanging your head off the floor. Bring your knees to your chest. And only go as far as you can tolerate. It might be pain here, might be pain here, might be pain inside the legs. It doesn't matter. Just go only as far as you can tolerate. Okay? And we're going to hold here, relax your ankles, relax your sacrum, your bottom, relax your tummy, relax your shoulders. If you're struggling to reach, you can use the rope right at the top of your knee there. Rest your elbows on the floor. And you can use the rope. So you're only pulling from the elbow. You pull the rope and you hold. So you're only using biceps tension, nothing else. Yeah. And that's the idea about this class. You only activate what's needed. Everything else can stay relaxed. When you think about yoga and Pilates, they are brilliant, brilliant classes, but they activate the whole body all the time in all the postures. But when the body's in pain, you're not ready for that yet. So this is a good way of gradually building yourself up to a Pilates or a yoga type class or a level 6 Soothe your back pain class. Okay. Okay, take a deep breath in. As you release, pull your knees towards your chest, very gentle and small movement. Hold in that new position that you just were able to bring your knees in. I only moved 1 centimeter, so it was very small movements. Okay, work with your small movements. I'm going to do one more deep breath in. As you release, bring your knees in and hold. So now a second stage that you found yourself that you can do. Just do normal breaths. Normal breath. Right, to come away from this position, again, I want you to engage your tummy. So imagine your belly button drawing back into your spine, and you keep your heels close to your bottom, and you can just bring your legs down with your hands and that. If you try to bring your legs there, too far away from your bottom, you're going to use a lot of power on your tummy. But if you bring it close to your bottom, there's no weight of the legs to your tummy, so your tummy doesn't have to work, very hard, but enough to be active. Okay, and we're going to use your dressing gown again, or yoga belt, and you're going to put on the ball of your foot, just like we did at the first movement. Bring it down, so you start from a lower position, and you're going to use the rope to lift your leg nice and slowly, only to the point where you feel the tension at the back of your leg. I can go a bit further, but I'm not going to. I'm going to stay here because I want to encourage everyone to stay at the first sign of tension on this one. It can be a very intense stretch. So we work with very low tension, and you're pulling your toes to down towards your face. Okay, we're going to do a little bit of a circle, very slow, very small. The bigger the circle, the more tension. The faster you go through the circle, the more tension. So go slow, go small, and you're just going to circle it. Now circle the other way now. And circle the other way. Okay, to come away from the stretch, bend your knee, and again heel to your bum, so it's close to your body and down. Okay, I'm going to do the other foot. So stretch your leg on the floor, start from the floor. Use your elbows to pull that rope, pull that leg nice and floppy, and only to that point of tension, nice and slowly. Hold nice and gentle. Those stretches at the back of your leg. You might feel all the way to your heel, okay, but that's okay. As long as it's little tension rather than big tension. And you're going to do a nice circle, so use your hand to guide the leg with a small and slow circle up in the air like this. And circle the other way. Brilliant. Brilliant. Good. Bend your knee and down to the floor. So you won't need the belt now. What we'd like you to do, rest your hands on the floor, palm facing down, feet together. And we're going to work with the core muscles. You might not be able to immediately engage the core muscles, but this is going to give you awareness where they are and what they could be doing. So let's go gentle. So the idea of the movement is to roll the knees side to side like this. Okay? I'm going to give you authorization to move as little as possible. If you only move this much or that much, it's fine. But I want you to concentrate on the core. Okay? So imagine your belly button, and the belly button is being pulled and drawn into your spine, into the floor. So even if you feel like you have a gap here under your spine, that gap should close down to the floor. So if you like this, it should flatten into the floor. So imagine you flattening that curvature into the floor, and the belly button is being drawn in, and you hold that drawn in sensation. That's all I need you to do. Hands on the floor, facing down. Okay, shoulders back, nice and squeeze at the shoulder blades. Shoulder blades and core have a very strong relationship. When they work together, your body is in aha moment. So hold that flat back onto the floor. Hold your shoulder blades flat onto the floor. And roll your knee to the right or left, keeping that flat back onto the floor. Only go as far as you can keep that floor touching your back. Keep your belly button drawn in. Bring your knee to the middle, back to the middle. Brilliant. And relax. And relax. It's a small movement. The knee is a distraction for how much you can control your belly button drawn in and your lower back flat onto the floor. That's all. The knee is the distraction. The whole work is controlling your pelvic flat into the floor and your belly button in. Okay? So you're going to flatten your pelvis. You're not lifting your bottom, okay? Flatten the curvature. Draw your belly button in, shoulders back, squeeze your shoulder blades. Roll to the other side gently and slowly, only until you can keep that back on the floor. You might find, oh, that's little. It is, but the amount of control you're building into the core is amazing. And engage your belly button in case it came, dormant again, and bring the knees back. Okay. Of course, if you have a very good core, you would be able to go as far as that. Okay, and you should be able to then engage your tummy and bring it back to the middle with the tummy engaged, and then go as far as you can to the other side. So there's a progression for you to think about, where you need to be able to control your core. If you go without the core, you're going to pull them. You can pull a muscle, you're not going to, but you can pull a muscle because the core is the stability for your back. And if you don't have this stability when you're twisting, things can go wrong. Okay, so safety first. Now we're going to do knee drop house. So feet together, same thing, you've still got your shoulder blades squeezed. You're going to open your knees and they're going to flop out like a butterfly. Only go as far as you can. Once you go as far as you can, if it's too much tension, I want you to hold your legs. If it's not too much tension, you can let go and let gravity work on the top of your legs. You can do that. At the moment, I'm using gravity. I'm just floppy, let go of my legs, and gravity's working. I can feel my knees just dropping more and more and more. If you struggle still, absolutely fine. You can pad cushions underneath your leg and flop on the cushions. Or you can hold on with your elbow supported on the floor, hold on to the lower leg, and you can flop on your hand. Okay? If you find all that strenuous, don't worry about it. help your leg back in. This is the same stretch as the one we did in the chair. So you can do the chair one instead and skip this one until you feel more comfortable, less when you're not feeling too much tension, opening your legs out that much. Okay, so that's brilliant. We're going to do the same stretch we did in the chair, ankle over the knee. Again, if you struggle, you can have it mid-shin. Your hands are going to go inside the leg that's on the floor. So inside, grab the back of your leg, pull it in towards you. All the work is on the elbow, and you should feel, in this case, the stretch is on my right buttocks. So the leg where the ankle is resting on the other knee. And hold. Make sure you're breathing. I put a lot of emphasis on level 2 on breathing, and I also teach some breathing techniques that will help you progress through the levels until level 6. It's very important to understand what kind of breathing you're having, because breathing sometimes, when they're dysfunctional, can actually cause back pain. So we'll learn about breathing level 2. You can bring the other leg over, and you can see I move very slow. Bring your leg in, so you're reaching inside your leg and on the outside. You should feel the stretch in this corner here. Hold, make sure you're concentrating on your breathing. And bring it down. Good. Excellent. So now we're going to go, we on level 3, we progress into more stability work in that position, but today we're just going to do movement. Okay? So I'm side bending. I like to have my cushion or towel or foam roller between the knees there, and that is to keep a good alignment between the hip and the knee. If you have your knee drop out like this, downwards, a lot of the times, especially in bed, we tend to wake up in that position. What happens to that position when you're sleeping like this for hours and hours and hours? First of all, look at my hand and my pelvis. The pelvis gets hitched up, folded in, and the hip muscles fully stretched. Yeah? So a lot of times people can have either pain on this hip or that hip, because when that hip is doing all this, the other hip is being a bit more compressed. So your body will eventually feel the pain either way. Okay? So it's very important to sleep with a pillow. It's a hard thing to get used to, but a little tip. If you learn to fall asleep in that position, subconsciously through the night, your body will do that. But it's that time where you're actually able to fall asleep, so it's a practice. You might have a position that you like to fall asleep, or you might have to work and allowing yourself to work on this position to actually fall asleep. When you're able to fall asleep in that position, you will know that subconsciously you're always going to be looking for that pillow between your legs, and your pain levels in the morning will be different. Brilliant. Okay, so arms together, rested on the floor, and imagine now your pelvis is stable, not moving. Your knees are parallel to each other, not moving. The only thing that's moving is ribs, shoulder, neck. Okay, and you're going to use your arm for guidance, but basically the movement comes from here. And I want you to roll over. Imagine you're trying to reach, and you're going to rest your hand on the floor if you can. Take a deep breath in. As you breathe out, draw your belly button in and bring your body back. So you're using your core to bring your trunk back. So using your upper core. Okay. If you struggle with tension on the shoulder, it's it's a good stretch to do. But if it's too much, take the shoulder away. Okay? Use your hand as an awareness of what your ribs is doing, and you can rotate with your ribs. Go as far as you can. Look around as well. The neck helps the ribs. And you're going to stop in that point where you cannot go anymore, but there's very little tension. Take a deep breath in. Breathe out. Engage your tummy and rotate back. Beautiful. One little trick. If you feel your ribs here touching the floor, okay, put your hand under the ribs and rest. So that movement that you just did to lift your ribs off the floor, to put your hands underneath, that's the movement we're going to work. Okay, and basically it's to align the ribs to the pelvis, because at the moment the ribs is dipped down into the floor. So we want to activate muscles that align the ribs with the pelvis. So hands under the ribs, okay? And now what I want you to do is lift your ribs off your hand. Hold, keep breathing. And slowly back down to your hands on the floor and rest. It's a small movement. You might not see what I'm doing. But then I'm lifting the ribs a little bit. Shoulders are relaxed. And you're holding your ribs off the floor. And down back to your hands. Brilliant. Okay, so to get up, we're going to use hands, elbows, everything from the upper body to get up. Okay, so push here. You're going to push with the elbow. You're going to push with your hands. Push into side. Use your hands. Come back. Brilliant. And we're going to do the other side. So, pillow between your knees, nice in alignment, hands in front, and we're going to do the trunk rotation. Okay, trunk rotation. You're going to look back, look behind you, go as far as you're comfortable. Hold that posture, not restraining, but we're relaxing into that posture. Might not feel much easy now, but it should get easier. Deep breath in. As you breathe out, engage your tummy. Brilliant. Okay, and we're going to do the technique of the lifting of the ribs. So put your hands under your ribs, just below the brow line, under your ribs, and rest on your hands. All you have to do is the same movement. Lift your ribs off your hands. Hold that lift. I'm talking about that much movement, okay? Hold your ribs up and slowly lower your ribs. Don't drop. Lower your ribs into your hands until you feel the whole weight of it. So lots of body awareness bringing in now. Trying to teach you how to control your body, understand your core, activate your core. Yeah, beautiful thing. One more. We're going to lift ribs off your hand. Breathe normal. I like to hold and allow people to go through a few breaths before we go down. So the body learns to activate the core alongside normal breathing. And that's what we do a lot on the level 2. And relax, drop. Not drop, sorry. Control the way down. Brilliant. Okay. So, again, elbow on the floor to push down. Hand on the floor to push. Lift your upper body. Come back. And you're up. Okay. So, in this position, I'm going to go sideways so you can see, but you can face me if you like. You might find yourself struggling to have this nice upright back. I certainly did when I first sat like this. I was there and I was hanging on to the mat because I was going to fall off. Okay. So if you are in that position, just accept it. That's your starting point, and we can always progress from here. Okay. So I'm going to do this position. I'm not going to do that one. I'm going to do this one. And you support it because your body feels like it's going back. Yeah. Can you see how much weight is going into your lower back? That's making your lower back muscles work so much. And that reflects when we're upright as well. Okay. So what I'm going to do here, imagine your pelvis, and your pelvis is a bucket. Okay. Imagine you fill the bucket with water. This half part of your body here. You're going to fill your bucket with water, and you're going to tip the water through the front of the bucket. So you're going to roll the bucket to see if you can tip the water that way. Okay. And then you're going to roll back and tip the water this way. So imagine the water moving forward and back. It might look like I'm blowing my tummy out, but I'm not. I don't want anyone puffing the tummy out. It's just moving the lower bit here. It's very gentle, small movement. If you have less movement than what you can see here, that's absolutely fine. Just work with what you have. So you want to move the water forward and move the water inside the bucket back and forward and back. So that's a little bit of pelvic roll that we can learn, and back and forward and back. You might find yourself doing this and this with the shoulder, or your knees might be doing this. Yeah. So if all of that is happening, it's a sign that your body's compensating with your shoulders and is compensating with your legs to accommodate for the lack of mobility into your pelvis. When that happens, we start getting issues down to hips, knees, ankles, and shoulders. The idea is that the body can work in congruence with all the parts, all the body parts, all the joints, but also can work in isolation. So we can isolate this movement and make sure that movement happens by itself, or we can make the movement happen as a group of body parts, body joints. So it's very important to be able to do both. The segmentation of movement, the isolation of movement brings the stability. When you combining the movement too much and you cannot separate, it takes your stability away, and that's where the body starts to fight gravity, balance. Then we have balance issues coming through, and you know that feeling that if you see someone doing something really adventurous, jumping off the third steps or something, you think, oh, if I do that, I'll probably fall. That is a feeling that you know your body isn't stable enough to sustain that impact on the floor. Yeah. Or if you have a near trip, tripping into the floor, and you think, I couldn't stop that tripping. Yeah. It's because your body is so connected. There's no segmentation to allow your body to react really quickly to stop you from that fall. And that's why isolation of movement comes, to help you with balance, to reflection, your reflexes, in case you have a near fall or anything like that. So you can change so much through your day-to-day activity. So I'm not going to go through any more movements. I think the video is getting a bit long, and I want to make sure that everyone can engage. There's a lot more to happen, and I will be doing a bit more, another hour video of the class every Saturday at 9:30 a.m. London time. That's GMT time, and I will be including some more videos different times in case we start to get more demand for different regions, and also we'll be doing a video in Portuguese. So I'll hopefully be able to put subtitles on these, but I think for videos of activity, when you're actually doing your activity, it's very difficult to read anyway, but I will see if I can add on some subtitles. And I hope to see you next Saturday. I hope that you enjoyed this video and have learned a little bit more about yourself, about your body, about how your body reacts to movement, and hopefully that I can keep bringing that awareness to you and helping you commit to this self-healing. It's a self-healing um, commitment. I have lots of different tools in my website. If you want to sign up for my virtual physio app, in this app, I bring lots of information. I can give advice 24/7 for the whole household. So if you have kids in sports and they get injured, or you're going through a flare up of something, the husband is having neck pain, just you have access to it for 12 months for £12 if you signed up. And you can always get in touch with me, the physio, ask questions. I'll give you the advice that you need. If I think I need, you need to see someone, I can direct you to see someone, especially if you're not in my area. But for £12 for 12 months, you have that initial consultation really for the whole family household, about any issues relating to body aches, body pain, injuries, chronic conditions. Um, yeah, lots of advice. Okay, so you have full access to me, and I hope to see you soon. Thank you very much.